Hello and welcome. I'm Jen Truax, the Director of Physical Therapy here at Hope Orthopedics of Oregon. I'd like to share with you some important elements to making your surgical outcome a success. I'll walk you through transfers and mobility so you feel more prepared when your surgery day arrives. The key to success after your surgery is to practice before your surgery. We recommend you take your walker when properly adjusted through your house to identify any barriers. These can include rugs, cords, thresholds, and even animals. You may want to remove some of these barriers from your home for a short time to allow you to move safely within your home after surgery. A gait belt will also be provided to allow your caregiver to assist you with walking and transfers. Be sure to wear this at all times when up and moving. Practice getting up and down from your toilet with your surgical leg placed out in front of you. Are you able to do so using your bathroom counter or a nearby grab bar? If not, we recommend that you rent or buy a toilet riser to improve your ability to use the bathroom. For ease of access from the bedroom to the bathroom, determine which side of the bed will be best for you before surgery. If a change is needed, make the change now to improve your independence afterward. The gait belt is also a tool to use to improve your ability to transfer. You can do this by looping your foot into one end. Use the other end to assist you in lifting your leg onto or off of the bed. Be careful to avoid chairs, recliners, or couches that may be too low to get in and out of safely. Be mindful to reach for the handles or the seat of the chair, and always push from the arms or the seat as opposed to pulling on your walker. Again, be sure to practice sitting and standing before surgery and identify locations that may not be safe following joint replacement. Assess the height of your vehicle and practice getting in and out with your surgical leg placed out in front of you. You may find that sliding your seat back as far as possible will help. We also suggest sitting in the car first, then swing your legs in as opposed to lifting your leg into the car first. Remember this motto: up with the good and down with the bad. Use your non-surgical side to lift and lower you to or from each step, protecting your new joint. When possible, use handrails, door frames, and have your caregiver present until you can comfortably perform these alone. Taking caution, being prepared, and practicing will make all of the difference in your post-operative experience. Some key points to remember. 1. Remove all rugs, cords, and obstacles from your pathways in your house. 2. Be cautious going through doorways and navigating surface changes. 3. Animals can be a tripping hazard. Prevent them from walking under or around your feet, or remove them completely from the home during recovery. 4. Always wear your gait belt. 5. Practice before surgery so you know what to expect. Practice ascending and descending stairs, getting up and down from the toilet, a seat, your bed, and your car. Your safety is paramount to all of us at Hope Orthopedics of Oregon and the Willamette Surgery Center. We want you to have the best experience possible and hope we've given you confidence in preparing for your surgery. Please be sure to read the patient guide provided to you by your surgeon for complete information about your specific surgery. The exercises outlined in the guide are critical to your success. Thank you.